Welcome to Solent Medicines Management Training. This presentation has been written for staff members who are required to administer or supply medicines under patient group directions. The learning objectives of this presentation are as follows: to enable you to understand what a patient group direction or PGD is, to inform you who can use a PGD, discuss the different sections of a PGD and explain how to use these to ensure medicines are supplied or administered legally, safely and appropriately, inform you when a patient may need to pay a prescription charge, inform you what records you are required to keep, and provide you with sources of help if you have questions about using PGDs. PGDs are defined as written instructions for the supply or administration of medicines to groups of patients who may not be individually identified before presentation for treatment. In plain English, patients who may not be identified before presentation for treatment means groups of patients that fit the criteria laid out in the PGD. A PGD can enable an appropriate healthcare professional to supply or administer prescription-only medicines to patients after making their own assessment of the patient without referring to a doctor or non-medical prescriber for an individual prescription. The medication can only be supplied or administered if the situation meets the inclusion criteria specified in the PGD, and supply or administration can only occur if none of the exclusion criteria listed in the PGD applies to the patient. We will cover this in more detail later on. If you administer or supply medicines under a PGD, you are not prescribing. Following a PGD is closer to following a written direction to administer that has been written for a specific patient. The key difference between PGDs and patient-specific directions is that a PGD can apply to any patient who fulfills the criteria specified, whereas patient-specific directions, as the name suggests, apply to individual patients. The idea behind allowing PGDs was to facilitate redesign of care pathways to improve patients' access to medicines without compromising patient safety. So, for example, a PGD for glucagon injection may enable a nurse to give glucagon to a patient with a hypoglycemic attack without having to wait for a doctor to authorise administration, which may mean the patient deteriorates and becomes seriously unwell. Legally, a PGD must be signed by a doctor and a pharmacist. Within Solent NHS Trust, all PGDs need to be approved by the Medicines Committee. After they've been approved, they are then signed by the Medical Director, Chief Pharmacist and Director of Nursing. They can then be used by members of staff. Legally, only certain registered healthcare professionals can administer or supply medicines under a PGD. Healthcare support workers may not administer or supply medicines under a PGD. The PGD should state which of these groups can use it. Use of PGD cannot be delegated to someone else. If you supply or administer the medicine, you must ensure that this is appropriate and the criteria specified in the PGD apply. Within Solent NHS Trust, individuals may only use a PGD if they have received appropriate training and they have been deemed competent to use the PGD by their manager. A competency framework available from the National Prescribing Centre may be useful for managers who need to assess the competency of staff to use PGDs. Managers must maintain an up-to-date register of all staff working under PGDs. Only staff on the register may use a PGD. We will now go through the different sections of a PGD using the Trust saline injection PGD as an example. When you are administering or supplying a medicine to a patient, it is your responsibility to check or be aware of the information detailed in these sections to ensure you give the medications appropriately, safely and legally. The first section is where the clinical situation or condition being treated is detailed. The medication may only be supplied or administered if the patient has the condition specified or the clinical situation applies. This section may specify more than one condition or situation that can be treated using this PGD. It will not always be a requirement for all the conditions or situations listed to apply to a specific patient. If more than one clinical situation or condition must be present for the medicine to be given, this should be specified on the PGD. For example, if a patient had a condition, then it needs to be a certain severity for the medicine to be given using a PGD. The criteria for inclusion specify more information on when the medicines can be given under the PGD. As with the defined condition/situation section, it will not always be a requirement for all the conditions or situations listed to apply to a specific patient. It may be that only one of the inclusion criteria need apply for the medicine to be given. If more than one of the inclusion criteria need to apply for the medicine to be given, this should be specified on the PGD. When you review a patient, if any of the exclusion criteria applies to the patient, the medicine must not be given to the patient, and the patient should be referred appropriately. The details of who they should be referred to are in section 1.6 of the PGD. If you are unsure as to whether or not a patient meets the inclusion or exclusion criteria, the medicine must not be given, and you are advised to refer the patient appropriately. The caution section details any circumstances where you may need to use your professional judgment about whether or not to give the medicine under the PGD. If any of the cautions apply to a patient, staff must be able to justify any decision they make about supplying or not supplying the medication. Where cautions apply, staff members may want to discuss the patient with a senior colleague or an appropriate prescriber, but they still remain accountable for their actions. If in doubt, staff are advised to seek advice. Section 1.5 or 1.6 detail what action the healthcare professional must take if the patient declines the medication or one of the exclusion criteria apply. Sections 2.1 to 2.4 specify the medicine that must be administered. Although this may appear obvious, it is important that this section is checked carefully to ensure the correct medicine is supplied or administered. Rather like a prescription chart will be checked carefully before a medicine is administered to ensure that the correct drug, strength, dose and formulation are given. The exclusion criteria may not specify all the clinical situations where the medicine may not be appropriate. For example, a patient may meet all the requirements laid out in the PGD, but if the PGD is for tablets and the patient can't swallow tablets, the patient may still need to be referred, so a liquid medication can be prescribed. Obviously, it is still your duty as a healthcare professional to assess the patient, discuss the options available for treatment, and only give a medicine under a PGD if this is in line with the patient's individual needs and preferences. Healthcare professionals giving medicine under a PGD are expected to have an understanding of the method of administration, how the medicine acts within the body, any dosage calculations that may be required, potential adverse effects of the medicine and how to manage them, relevant drug interactions, precautions and contraindications, storage requirements including maintenance of the cold chain for fridge items, follow-up arrangements. When giving a medicine under a PGD, you should be able to give the patient or carer appropriate advice about the medicine. Section 2.5 specifies the route and method of administration. Clearly this is important to ensure the medicine is given safely. Section 2.6 and 2.7 specify the frequency of administration and the number of doses that can be given. Again, this is important as it may not be appropriate to give the medicine indefinitely without review by a prescriber. Section 2.8 lists the side effects of the medications. This may refer you to the Summary of Product Characteristics, or SPC, that are usually available at www.medicines.org.uk. This information may be useful in terms of deciding whether or not to give the medicine and provide appropriate information to the patient. Section 2.9 and 2.10 detail any information on follow-up or advice after treatment which must be given to the patient or carer. All PGDs used within Solent NHS Trust have an expiry date. The PGD must not be used to give medicines after the expiry date. The Medicines Management Team regularly review and update PGDs. If a PGD still needs to be used and is approaching its expiry date, it may be possible to grant an extension letter. Please contact the Medicines Management Team if this situation applies. To ensure that you are always using the most up-to-date version of PGD, we advise you to check the PGD webpage, which can be found under Medicines Management on the intranet. So, to summarise, within Solent NHS Trust, you may only administer or supply a medicine under a PGD when the situation or conditions listed in the PGD applies to the patient, one or more of the inclusion criteria applies to the patient, the exclusion criteria do not apply to the patient, any cautions have been considered and if necessary discussed with an appropriate prescriber. The medicine being given matches that listed in the PGD, the drug name, form, strength, etc. The dose, frequency, route of administration, and total number of doses on the PGD can be given to the patient. The PGD has not passed its expiry date, and the PGD has been signed by the medical director, the chief pharmacist, and the director of nursing. If you are supplying a prescription-only medicine for the patient to take home, this must be supplied in an appropriate labelled pack to ensure that the patient is given appropriate information on the medicine and the legal requirements for issuing medicines have been fulfilled. The PGD should state the legal classification of the medicine, prescription-only medicine, pharmacy medicine, or general sales list. Pharmacy and general sales list medicines do not need to be supplied like this under a PGD, but should be supplied in the container that came from the supplying pharmacy. Pre-labelled packs, also known as pre-packs and TTA packs, must be used for this purpose for prescription-only medicines that have been obtained from a pharmacy. When using a pre-pack, you must write the patient's name in the space provided, write the date the medicine was issued to the patient in the space provided, complete the directions if necessary. On some pre-packs, you may need to add the number of tablets or capsules the patient is required to take, the number of times a day they are required to take it, and for courses of treatment, the number of days the patient is required to take the medicine for. There will normally be a box you should initial to say that you have issued this to the patient. Where possible, you should obtain a check from another healthcare professional and ask them to sign the checked box. A patient information leaflet should be supplied with the medication. This should be in the pack. Unless you can lawfully dispense medicines, i.e. or a pharmacist or a doctor, you may not remove or add medications to the container. If the contents of the pack contain more doses than is required for the course of treatment, the patient should be advised of this and advised to take the remaining tablets to a pharmacy for safe disposal. You are not required to issue a pre-labelled pack if you are only administering the medicine, e.g. if you are administering one injection. A patient information leaflet does not legally need to be supplied to the patient if you are administering the medicine, but are usually available at www.medicines.org.uk if the patient would like one. Patients who have medicines supplied under a PGD may be required to pay a prescription charge. Further information can be found on the NHS England webpage. If necessary, your department will need some kind of arrangement to process any payments. Prescription charges do not apply to patients only having medicines administered under a PGD. Any records you are required to keep should be detailed on the PGD. This would normally include the date and time of supply or administration, the patient's details such as name, date of birth, allergies, and how the patient met the criteria of the PGD, the details of the medicine such as name, strength, dose, frequency, quantity, route and site of administration. The batch number and expiry date should be recorded for vaccines and blood products. A statement that a supply or administration is by using a PGD, the name and signature of the healthcare professional supplying or administering the medicine, relevant information that was provided to the patient or carer, and whether patient consent to treatment was obtained. If you are interested in developing a PGD to help improve your service, these resources may help. If you would like any assistance with writing a PGD, please contact the Medicines Management team. You can find more information on the rules governing PGDs in the Solent Medicines Policy. Current PGDs that are approved for use within Solent can be found on the internet under Medicines Management. It may be worth you having a look at what is available. If you feel a PGD may be relevant to your practice, we would advise you to ask your manager if they will assess your competence to use the PGD and sign you off. If you have any questions about this presentation or PGDs, please contact the Medicines Management team. Please record that you have completed this training by completing the SurveyMonkey questionnaire. This training is regularly reviewed and updated, and your feedback is important. Please could you also take the time to complete the short evaluation questionnaire. Many thanks.